On Wednesday, the federal government approved California's overhaul of the nation's largest insurance program for low-income and disabled residents.
Officials say the decision will allow Medicaid money to be spent on housing-related services as California struggles with homelessness and a lack of affordable housing. In a statement, Governor Gavin Newsom said, "We're making Medi-Cal, which provides health care to 1/3 of all Californians, the most comprehensive, robust such program in the entire country." Starting New Year's, California will expand what had been a limited whole-person care pilot program to eligible Medi-Cal members statewide. According to officials, the goal of the new approach is to address underlying societal conditions, particularly in populations with fewer healthcare services. New services include treatment for substance abuse, expanded dental benefits, and restored coverage of chiropractic services for Indian Health Service and tribal facilities that were eliminated in 2009. The state also expects approval from the Centers for Medicare and Medicaid Services early next year to expand services for those involved in the criminal justice system before they are released from incarceration, so they continue receiving those services in the community. California's Medicaid program offers government-funded insurance to people 50 and over and 25 and younger, regardless of their immigration status. California has the nation's largest Medicaid program.
Officials are clearing out homeless encampments in Los Angeles' Koreatown. Full encampment clearing will begin next week.
Los Angeles' Council District 13 is preparing to clear large homeless encampments in parts of Koreatown. On December 23rd, Councilman Mitch O'Farrell's office put up flyers to notify tent residents of a major cleaning on Tuesday. LA Sanitation began cleaning up one of Koreatown's largest encampments at Chateau Park. Koreatown residents have said they felt unsafe in their neighborhoods due to an increase in crime. One said that their mailman was assaulted. Others, such as the activist group K-Town for All, criticized the timing of the enforcement. They said there's a spike in COVID-19 cases and that shelter capacity is limited. A full encampment clearing is scheduled on January 5th.
A UCSF doctor says COVID-19 could be similar to the flu by early next year, but encourages people to continue being careful amid the current rise in cases. In a series of Twitter posts on Wednesday, UCSF Dr. Bob Wachter said there are some positive trends despite the recent rise in COVID cases and the Omicron variant. He wrote that COVID could be more like the flu by early February, with a majority of the U.S. vaccinated or protected by antibodies. Wachter says vaccines prevent hospitalization and new oral antiviral pills hold great hope. He predicts that people would be able to go back to normal in 6 to 8 weeks. Tesla is recalling certain Model 3 and Model S vehicles due to safety concerns. The total number of recalled vehicles is close to 500,000.
All Model 3 cars from the years 2017 to 2020 and Model S cars between 2014 and 2021 are included in the recall, the National Highway Traffic Safety Administration announced Thursday. Tesla said the recall is due to a cable for the car's backup camera that can be worn out and fail to transmit images to the driver's main console. Tesla submitted a safety recall report on December 21st, saying over time, repeated opening and closing of the trunk lid may cause excessive wear to the cable that provides the rear view camera feed. The report added that the loss of a rear view camera display may increase the risk of collision. With both car models, Tesla says it is not aware of any crashes, injuries, or deaths caused by the defect. Tesla discontinued the problematic trunk harness at the end of 2022 for Model 3 cars. All 2021 Model 3 vehicles have a different harness design. On Thursday, Tesla's stocks were down 1.1%.
For many years, California has been trying to pass laws that would allow the creation of drug injection sites. A coalition of groups have actively opposed the idea. The coalition sent a letter to the White House asking for support. Here's NTD's Cynthia Kai with more.
A coalition of 11 groups against drugs sent a letter to President Biden and U.S. Attorney General Merrick Garland last Wednesday, asking for their support in preventing drug consumption and injection sites. The coalition expressed concern about Senate Bill 57, which would allow sanctioned safe consumption sites in California, where people can inject illicit drugs under medical supervision. The letter urged the enforcement of federal drug laws, saying all levels of government are responsible for protecting people from drug abuse and overdose deaths.
That safe consumption sites are a bad idea is that we don't need consumption sites. What we really, really need is more safe, sobering sites. Every day, in the emergency department, I discharge patients who suffer from a substance use disorder.
SB 57 is not the first bill attempting to establish such sites. The speakers cited the rejection of Assembly Bill 186.
In 2018, former Governor Jerry Brown even issued a very strong veto letter reiterating that allowing the use of illegal and destructive drugs will never work. This is certainly not a partisan issue.
Then Governor Brown returned AB 186 without his signature in 2018. Brown stated in a note to legislators that he does not believe in establishing government-sanctioned injection sites for illegal drug use. Members of the international community, whose areas have already established such injection sites, provided feedback on their effect.
The writings that's about the European injection sites, there are no real evidence that they have lowered death rates or that they have lowered the rates of criminal behavior or crime. Actually, in some places, the most places, the death rates are higher.
Carlson says drug injection and consumption sites are not the solution to drug overdoses.
Drug consumption rooms is a whole other thing. I would say that it's not a solution, but it's more like an illusion of a solution.
Canada also has drug injection sites. A speaker from Canada said the sites increased drug consumption.
So why such a soaring increase in the number of homeless people around Vancouver downtown east side? Why? Because that injection site has become a huge magnet, drawing drug users, not only drug users, but also traffickers.
Proponents and authors of the bill say such sites can reduce drug overdoses and addiction.
In the many years that these programs have been in existence around the world, 170 of them, there has never, not once, been a recorded overdose death in any of these facilities.
Some speakers said a better alternative is treatment and rehabilitation programs to help addicts remove their addiction to drugs.
There are at least 1,000 people in Canada doing honest, decent, wonderful recovery work, and they serve 10 to 20,000 addicts on any given day. And I would estimate that 25 to 50% of all the people who go into recovery actually find recovery.
He says rehabilitation is not easy and relapses can occur, but in his experience, works. The coalition will now wait for the state assembly to hear SB 57 after the legislature reconvenes on January 3, 2022. Cynthia Kai, NTD News, California.
The isolation period for fully vaccinated NHL players after a positive COVID-19 test has been cut from 10 days to 5. Provided they meet a set of guidelines, the NHL and its Players Association said Wednesday. In order to leave isolation 5 days after a positive COVID-19 test, vaccinated players must not show a fever or other symptoms and return a negative PCR test. While the move applies league-wide, players in Canada, where the league this week postponed 9 games due to attendance restrictions, may be subject to much stricter regulations. As always, I'm Thomas Christian, and thanks for tuning in.
That's all for tonight. You can join us again on California Today every weekday at 8 p.m. If you have any news tips or ideas for the show, feel free to let us know. You can also find us on Twitter and Facebook. I'm Daniel Hall. Have a wonderful evening.